Good day, everyone. Thank you for your participation. Thank you for joining for this webinar dedicated to the practical session showing treatment with focused and radial shockwave therapy. My name is Mary Christine Collette. I am education specialist promoting the Swiss DuoClast Academy training programs worldwide, and promoting Shockwave and DDT experts. Today we are welcoming Dr. Peter Stiller. Hi, Peter.
Hi.
Peter is a specialist in general medicine, in emergency medicine, and is also a specialist in sports medicine. And he will show us today how you can treat in your daily practice, how you can improve your shockwave treatment and DDT and DuoClast treatments with your devices. So as you can see on your screen, you have a Q&A and chat section. Please feel free to use them if you have any questions, and we'll be able to ask them during the session. And that's it for the introduction. So the mic is yours, Peter.
Hello, everybody. Welcome to all participants. I'm pleased how many have taken place here. It's great. Thanks, MC, for the introduction. We have a little change now because that was my mistake. I have the cases for the upper limb and back today, and not the lower limb, how it said on your invitations. I hope this is okay. It's because I have both webinars prepared, but I have 2 or 3 more cases for the lower limb that are really, really good, but I couldn't get them in for this date that we have. So I hope you are okay with this to start with upper limb. Is somebody who doesn't want it at all? So you can write it down if you want now. Okay, no waving hand, very good. Okay, then I would say let's start. My introduction is very short because MC did it before. Very proud to be able to show you some cases of the last years that are, I think, extraordinary and very, very special for the results that we could reach concerning upper limb and back now at the moment. And it's only possible with the use of the DuoClast, and that's why I want to show you. The first of all I want to show you is the frozen shoulder problem. I think we have a lot of frozen shoulders. I don't know how it is in Asia, but here in Europe very, very often. I'm not quite sure why this is an upcoming problem. I think it may be that the diagnostics is getting better and better. And so this can be earlier diagnosed and treated than before. And I have here for you the stages that you can find in the books if you want to read about a frozen shoulder. I think the stages are not really like stage 1, 2, 3. It's more like a liquid. It comes from 1 to 2 and 2 to 3 without any real stage between it. So this is nice to know, but at the end, it's only important that you have a very, very long time with pain and the restriction of movement that you have until it gets better. If you don't do anything or only physiotherapy, in the studies that I found, it's between 27 and 33 months. It's a very, very long time, and you can get it much shortened by using the DuoClast. I'll show you one lady with a mother of 2 children. They were at kindergarten at school with my children, so that's why she came up to me and asked me if I can help her. The problem was she was suffering from bad pain and movement restriction and in her shoulder for a month. When she asked me, it began with a much too heavy load when she was working in the garden with very, very heavy things moving around. And after that, in 1 or 2 weeks, it was a horrible pain in her shoulder. She had multiple cortisone injections, oral cortisone for weeks, brought her 10 kilograms more at weight. She had various painkillers up to morphine, and physiotherapy. It didn't work at all. And the MRI from August 2017 showed the capsulitis and showed peritendinitis and bursitis next to it. And in October, when she came to me, she had an abduction of 10 to 15%. That means she couldn't get her clothes on without help of her children. She will tell us in a video at the end, but the video is in German, of course. So I tell you at the end what she says. But I wanted to show with the video how bad they are suffering, people with frozen shoulders, that after the treatment, she was so happy that she sent me a thank you video. And I think if people are doing that, you know how big the problem was in their daily life, normal daily life. How did we treat her? We started, of course, with radial shockwave because we want to touch the whole capsule of the shoulder joint, because this is the problem. We have a adhesive capsulitis, and we want to touch every part of the capsule and get the inflammation away so that we can have much less pain and more movement. I did a few things also, so we did laser treatments. It was not the good laser that EMS is now, not the high power laser of EMS. It was an older one because 2017 we didn't have it. And we did the cryolight. That's a hyperbaric CO2 cooling system, very, very fast cooling and very, very good against the pain too. And Medivit Cryo is bandages, cooling bandages and compression that we use too. But the most important part was, of course, the shockwave part. And we could start with 1 to 1.5 bar, very, very low for a shoulder. Normally we get much higher pressure on the shoulder, but here in this very painful area, it's not possible, and it was not possible. And after 5 treatments, we reached 2.5 bar without problems. So you see, it's getting very, if it works normally, it's really fast that the people have much less pain. For example, here she could sleep again, which was very, very important for her. Put this away that I can see it. So was very, very important for her that she could sleep again, because she had not more than 2 hours per night in a row that she could sleep. After 8 treatments, we were with 3.0 bar at the shoulder. That's a lot, especially when you suffered from such big pain before the treatment. And that was the most important thing. We had an abduction of 120 degree, which is like this. And you can do everything on your own. It brings you back your life quality, and that you can be on your own. After that, she said, "Okay, that's enough for me for my working life and my normal daily life." So she stopped Shockwave and did more physiotherapy with well-known physiotherapist in her next to her. That was great for 3 months. Then she got back with a pain, and I wanted to show you there's a pain, the frozen shoulder. If it comes back after a few months, maybe, or sometimes it's a pain that stays when you did everything right. There's a pain nearly here. Maybe it's the deltoid point where it comes from, but I'm not quite sure, because nowhere in literature you find something that especially points out where this pain comes from, but a lot of them are suffering from it. The good thing is that you can then start again with Shockwave, and normally, or for example, we did physio kits like an electricity that you can put on to train the muscle a little bit over there. And then after 3 or 4 treatments, we got this pain away, and she is absolutely pain-free until today. So frozen shoulder is a big problem. You can treat it very well with a Shockwave. If possible, put some cooling stuff onto it to get faster results, because the pain is going away faster if you put it together with the cooling. But all in all, it's a very, 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 very good treatment. Sorry. And the people stay symptom-free afterwards. And as I said, it's in German. I just want to show you that there is someone.
Meine sehr verehrten Damen und Herren, 2017 erlitt ich eine frozen shoulder.
That's okay. There's someone who has suffered so much that I didn't say anything. She came up and said, I want to show you, I want to thank you with this and show it to others that they know that this can be treated, because she had in her family a lady with about, I think, 37 years, and she was suffering for 3 years. And that was because she had panicked because she knew this story. And so after this few months, she was perfectly happy, and that's why she did the video. Next to the upper limb is always the back, I think, especially the cervical spine, of course. And I have here a case that is or that was really bad for the patient because he was suffering. Is really a strong man, I have to say. You will see him at the end. He was suffering from a very, very bad lumbar and cervical problem. And together, and he's had a private insurance that's not always very positive in Germany, because maybe he will be operated easier than not, because clinics try to get their money out of the operations. And in this case was the same. He was told he has to be operated because you can see it here in blue. He had a lot of diagnosis from his back, and he had really problems. He was suffering from a bad pain. He couldn't find any position to sit or lie. When he get up, it was a stinging pain in his back. The same problem was with his cervical spine. I will show you. Here are all the problems: the erosive osteochondrosis, activated spondyloarthrosis, and facet syndrome, the spinal canal stenosis also, and the constrictions of the neuroforamina. So you see it's a lot the same as with his cervical spine. I go through this narrowing of the neuroforamina. He's also activated osteochondrosis. And he was in 2 private clinics, and they told him first physio and no OP. The second date, they said, okay, now it's only an operation that we can do. The second clinic told him, okay, you can continue physiotherapy, and in midterm we do the spinal fusion. The funny thing is, in midterm we do the spinal fusion. He got out with the date next week for the operation. And that's why he came to me, because he is very, very sporty. He's really cycling a lot, and very, very long-term cycling, so about 3,000 kilometers in a row over a few days. And he loves to do that, and doesn't matter if it's a racing cycle or mountain bike. He's doing everything, and he wanted to do it now much more because he's 59, and wanted to get a rest from work and do more sport. And that was absolutely, in this case, not possible. As you see here, he had a visual analog scale every day between 7 and 9, a stiff neck all day, and tension headaches that were really make him really suffer. And that's why he came and said, okay, if they do the spinal fusion, cervical and lumbar, can I do my sport? And I said, ooh, that's very, very difficult. And then he said, can we do anything else? And that's why I tried. So much diagnosis, sorry. Why I tried it with the DuoClast. You see here how we work on the upper thoracical spine, and then on the cervical spine. Here on the other hand, you see it on the lumbar spine and the ESG, right? And here I wrote down how we treated him. I always start with the big applicator of 36 millimeters, and I always work with 20 hertz. It doesn't, and if you have an EMS device, if you have a DuoClast, it doesn't matter which kind of frequency you use. But if you have the possibility to use 20 hertz and have the same pressure, all the contenders don't competitors don't have this. If you have the possibility, try 20 hertz and work with 20 hertz, because you are faster and have the same results. On the neck and the shoulder blade and the upper thoracic spine, to the cervical spine, I normally take between 2.0 at the beginning and afterwards 2.7, 2.8 bar. Here we could start with 2.0 and then it got very fast, got better. And we could go to 2.6 bar, and the trigger points all around it in your neck I work with every treatment. And for the cervical spine, I always use 1.0 to maybe 1.3 bar, but not more. You don't need more, and you don't have to to reach a point where the patient is very painful. It's normally enough to take 1.0 to 1.3 bar, have a little pain maybe, but that's enough for all the muscles and the little joints, paravertebral, that you want to treat. He was with his lumbar spine. He was, sorry, that's cervical spine, I should say. It was his cervical spine. He was symptom-free after 3 treatments. His visual analog scale that you saw between 7 and 9 went down, decreased to 1 of 10. And I also took an osteopath specialist one time in 3 months to treat him also, and that was very good because I think the combination is perfect. I do my chiropractic on my own and it works perfectly with the Shockwave, but to have someone, a physiotherapist who is really good, or an osteopathy specialist by your side is always very good. With the lumbar spine, it was the same. We started the sacroiliac joint with 2.3 bar, could get up to 3.0, lumbar spine the same. As you see, after 4 treatments, he had no pain when standing up, which was terrible at the beginning. He had the visual analog scale of 2, and we stopped the treatment weekly then and treated him every 4 to 6 weeks, and it's absolutely enough. He has no problem. He went for a long cycling race the last 2 weeks, I think at Fuerteventura, for about 1,500 kilometers in a few days, and without any problem, as I heard. And this is the guy you see. He's, for his age, he's really good, well trained. And if you have someone like him, done a spinal fusion, cervical and lumbar, for such a guy, life is over, because sport is his life. And he couldn't have done this for example, on Fuerteventura with the racing when he was operated. So
ja, hallo Dr. Stille.
You see him laugh.
Ein kleines Video von mir.
You see that he's smiling, and what he's saying is that he couldn't believe it, but he had no problems after 4 weeks and until now, and he can do his sport, so he's very, very happy. Another example for problems with your cervical spine, especially with upcoming tension headaches or tension headaches for years, as you can see here. This is a cervical spine pain with from a patient who was suffering for 8 years from this, and for the last 5 years she couldn't imagine one day without tension headaches. It was really terrible. She had given up completely, and we were talking about other things. She didn't came because of this problem. Then I asked her why she has such a stiff neck, and then she told me the whole story. And then we started, and then she said she's already depressive, and it took away all her life qualities, so that she tries to get through her life, but she doesn't have any quality anymore, and she's with a psychotherapist. Without him, she couldn't go on living, and that was really, really, really depressive also for me. And then she showed me the MRI of 2016. That was, I think, half a year before she came to me, and you see that there are a lot of things that can be, I think, could be operated, but she didn't want to be operated because of a really bad operation in her family on the spinal cord. She didn't want that. And then I said, okay, you did so many things. You see it here down there, the chiropractic, physio, medical rehabilitation for weeks. She took all painkillers that you can imagine, I have the names down here, acupuncture, magnetic field therapy, ultrasound therapy. She had given away hundreds and hundreds of euros for this treatments and had no benefit. And then I told her that we can try Shockwave at her neck. At this point, she had, as you can see here again, massive myelinosis, restriction of the function of the cervical spine, as well as rotation, as inclination and reclination. She had very strong pressure pain. If you touched her paravertebral, it was terrible for her. And the trigger points too. And that was up to the occipital points where the muscles and are beginning. And that's why we worked completely on her neck and her upper thoracical spine and her cervical spine. And we started with very low pressure. You see, it was at the beginning 0.6 bar. It's really not much. And did it to all trigger points, did it to all muscles, all paravertebral joints. And then she said at the occipital points where the pain was really hard, she said, oh, that's the point where all my tension headaches start, and after 5 seconds they were gone. And that's something that I want to tell you, that this is nearly in every treatment, this is the case. After 3 or 5 seconds, the people say, oh, it's getting much better. Okay, it's loud and it's sometimes for them very new, but after the 5 seconds that you stay on the occipital trigger points, it's like getting free again for them. That's really impressive, and it's nearly always the same. If this happens, you can tell him, okay, let us do 2 or 3 more treatments and all your tension headaches will have gone. Maybe that you have to work on them every 6 or 8 weeks later, because this is a chronic problem for a lot of them, because of the problems they have with their little joints, paravertebral, and maybe the prolapse or something that always does a little bit, force the problem and make the myelinosis. But if you work on them every 6 to 8 weeks, I think they stay completely symptom-free. And you see here, after 3 sessions, she was telling me that it was a massive improvement of the pain. She was treatable with 2.4 bar at the trigger points and the shoulder blades, and the movements were much better. And after 5 sessions, she was completely free of pain, which was for her, she had to cry a little bit when she was telling me that, because she was suffering for 8 years, as you remember. And now she comes every 6 to 8 weeks, as I told you, and there's no problem anymore. Now a very bad case, because the lady was very young when it began. I think she was 22 or 23, and she had an accident. She fell from a glass roof from a height of 4 meters. Had a complicated. It was 4 years ago when I met her. She had a complicated fracture of the clavicular, right? Had joint dislocation, had several upper rib fractures, and she had, until she came to me, 8 or I think even 9 operations and 4 times pseudarthrosis. Didn't matter what kind of fusion they did, which kind of metal they used. She always got the pseudarthrosis again, and had, in this time, constant pain. And they were thinking she has got a Sudex disease. As you know, you can get this if the healing is stopped somewhere, and the Sudex is something that is really painful, a chronic problem, very bad. And I'll show you photos that you can see it immediately. The clinical examination showed a clear pressure and movement pain. The pain at rest was between 3 and 8, depending on how the position was, especially when she was sleeping. She had the same problem, that she couldn't find a point where she could sleep for more than 1 to 2 hours. She had an abduction of 130, an antiversion to nearly only 140 degrees possible. I show you from, she had an examination show that she will have problems for all of her life. That's always that you have something like this in Germany for the insurance, that they have to pay then if you have an insurance, and she had that. And she had a big lymph edema in her arm that made us think that this is a SUDEC. Here you see the diagnostic they did, and then the report she had, that this is something that stays for her whole life, and that the insurance has to pay. Here you see it on both sides. The right side is much less, the movement of the right side is much less than on the left side. The green is left and the red is right. And here it says the last operation was in October 2019. On the left side of the file, you can see it, operation at Arcus Clinic in Pforzheim, a very well-known and very famous clinic in Germany. And after this didn't work as it was told her, she was, and the SUDEC came up. She was searching on her own who can help her, and she found Professor Schmitz at the internet, and he told me, can you please try to help her, because Professor Schmitz doesn't work as a general practice or an orthopedic. So she came to me to a bad journey every time she came, because of 1.5 hours one way. So she was traveling 3 hours for one treatment, but she did. Here's the translation of the part where it says how she is suffering and how she will be suffering in the future. This is how she was investigated by the doctor who had to find these results. I want to show you before the last operation. This is here her hypertrophic pseudarthrosis in here. That was before the last operation, but I took this picture because you can see it better. Now this was 6 weeks after the last operation, and it looked not bad, means that there was a little sign that the bone finds together now. And 7 weeks later, they didn't do anything else, or she didn't have any accident. 7 weeks later, it was exactly the opposite. The bone was wider than the bone gap was wider than before under the plate. I will show you afterwards. The former fracture gap is now only cloudy, was the first one, and the persisting pseudarthrosis suspected was the second one. So yeah, it was getting worse and worse. And now you see the difference. This is the light violet arm is the arm where they think she got the SUDEC. And I think if you see that and the swelling and know that this is the side where she had the accident, it's clear that this should be a SUDEC disease. And therapy was that we did the radial and focused shockwave, we did laser, we did, of course, cooling again, and all the things that I do normally with vitamin D3 for people with bone problems. Vitamin E is an anti-inflammation, cooling bandages, of course. And then we started with the Evo Blue, as you have, with the big applicator, 36 millimeters. The second treatment was already possible to take the 15 millimeters applicator, and we could go up to 2.5 bar. That's a lot. If you see the scars here, she really was suffering over years. If you can see how dark the skin is, this always a sign for the SUDEC too. And that was before we started, but she was a strong lady really, and she had pain when we were treating, but she was really strong, had 2.5 bar later, I think about 3.2 bar at the end. And it was combined with focused shockwave, of course, in this case, because of the pseudarthrosis, and it works perfectly together. And after the from the fourth treatment on, she had no longer the feeling that the right arm is much heavier and swollen, and got very, very fast improvement. From the 5th treatment on, she didn't have any more pain. And from the 6th on, she had the full range of movement. So after 9 treatments, we made a checkup with a CT. And now you see the plate that they put on it for the fusion. And here where the red arrow is, I tried to show it with my arrow, here was the gap. And now here the gap is gone. I have a second model to show you. Here's no gap anymore. Here was the big gap before, and the gap was also there with the metal in. Now you see it from both sides, and you see that the bone goes through. And if you see this and have a pain-free patient, the work is done, I think. On these pictures, you can see it also before the operation, after the operation, and then that goes through here. And then the radiologist said, we have, as you can see here, increasing consolidation of the bone. And she also sent me a video. I don't know if this is a German hobby, but they sent, and a lot of times I got videos to say thank you and to help other people by showing these videos. Of course, they are in German, but she is still again telling her story and how long she had to drive for every treatment, but that it was really a success and that she's so happy. That was in May 2020, and in August she came for the last control, and then she was swimming again because she did swimming very good before the accident and couldn't swim for 4 years. And when she came in August, she was swimming all kinds of techniques again and was very, very happy. And with this problem here in your shoulder, swimming all techniques that are possible, I think this is really a great success and a great result for the treatment.
Mein Name ist Melanie Bullig. Ich hatte vor 4 Jahren
now to come back to upper limb, I will show you something with the hands now, and this is very important for me because I think this is one of the most impressive diagnosis that you can treat with a shockwave, and I think it wasn't done for years. We could have started earlier, but I don't know why nobody tried it. This is a polyarthritis patient with very bad pain, suffering for years. You see, it began when the age of 29 for her. The funny thing about it is that her mother had the same problem exactly at the age of 29. So in this family, they start very early with the problem. She couldn't, when she came up, she couldn't fully straighten her fingers. She couldn't wear her wedding ring for 10 or 12 years now. She was so in pain that she had to move her fingers in the morning under hot water for 10 minutes to start in her day. And she had a laundry with which was her life, because she brought it up years ago, and she was thinking about quitting it because she couldn't do the work again. Now you see the fingers here. I think everybody can imagine that fingers like that are really painful, and you see the swelling of every finger. That was at the beginning when we started, so it was really, really bad. And to see how we do, I'm only working from the palmar side, means you don't have to be on the back of the hand. It's absolutely enough if you do it inner side of the hand, and you work on every joint that you can find in the hand, and you work like a lymphatic drainage from the beginning of the fingers always to the carpal tunnel. Very important, always over the carpal tunnel. You can also work with people with a carpal tunnel syndrome very, very well, and you can, in a lot of cases, you can stop, you can help them not to be operated with their carpal tunnel. And if you work on the hands, always put everything over the carpal tunnel so that you have a better lymphatic drainage. The result was great. After 4 treatments, she had no symptoms anymore, and she could wear her ring, her wedding ring again, which made her also cry a little bit because for 10 or 12 years you cannot wear. You have a nice man at home, but you cannot wear your ring because of your swollen fingers. And then after 10 years, this is possible again. It was funny, and from the first day on, her husband saw it, and he also had a few tears. It was really emotional. And then we went on with working here every 2nd week for 1 month, for 2 months, and then every 4th week. And today it's about 6 to 8 weeks, sometimes 10 weeks that she can move her hands properly and has no swelling. And that's a great result. The second case for the polyarthrosis or polyarthritis, I show you now. It's nearly the same. You can see here one of my helpers at my office does the treatment exactly the same way as I do. And in this case, the lady had, after 3 treatments, no more real pain in her daily life. Mobility was better, and after 5 treatments, she was entirely pain-free and could do her gardening work. What was very important for her, because she loved it and she couldn't do it for month and month. And now we're working every 8 weeks, and she's doing, or she's in the garden every day. This is before the first treatment of this lady, and this is after the 5th treatment. And I think you can see that there's much less swelling. The straightening of the fingers is much easier here. And this is a normal result, and I would say 95% of the cases we have such a result. This is a little bit difficult case to show, because this is a patient you see here on the left side. He was suffering from lung cancer, had brain metastasis, had then a spastic hemiparesis on the left side, which is one of his biggest problems, or was. Also, he had big problems with his shoulder, and shoulder adhesive capsulitis means a frozen shoulder in the same time that he had this spastic problems. And all the medication that he took didn't help at all. And then we started treating him, and this was a very special case, because this is he's from the family of one of my colleagues here. And the guy was really suffering at this time. And then you can see him, the left arm is, in this case, after the operation, like a soft arm. And afterwards, after that, he came up like this, with this spastic position of his arm. He couldn't move his left hand. He couldn't move his elbow. It was like stuck in this position. And then here's a video after 3 treatments by Shockwave. He wanted to show what he can do.
Therapien bei Dr. Stiller geht es meiner Schulter schon so viel besser. Schmerzfrei.
What he's saying is, after 3 treatments at our office, he could move his shoulder, he could move his elbow a little bit, and he's pain-free for the first time after 3 treatments. It's not always like this, that it's so fast, but in this case it was really perfect, and he could go on and train. And if you have a patient who is working with you with such a compliance, look at this. Then you can really work with such a guy. And we had a course in Germany where he came up as a live patient, and I did a little trick on my friend Thomas Meyer here, his physiotherapist in Germany. He's a great guy, working with Shockwave for years, and he's very good at the spasticity problem. And I told him that we do the course together, and I bring him a patient he doesn't know, and then he had to work with him. And it was great to see, because he worked on all the muscles that were hardened, of course, because of the specificity. And then I don't show you all, but wait a second. What I want to show you is that they're really working hard while Thomas tries to get his muscles a little bit straightened and make him better move. He's working with the Shockwave with a lot of pressure on the same muscle. You can see he's working on the flexors and the extensors of the whole forearm. And if you go further, he's doing the same with the hand. Wait a second. Here. And he was also, that's what I wanted to show, he was also working on the whole neck part up to the cervical spine. That's very, very important because this all comes together. And if you don't work on all the way up, all the muscle chain, you cannot be successful. You have to do more than only working at the place where it takes part. And in this case, it was unbelievable. After a few weeks of treatment and his training, he could open up a bottle. Now he can really do nearly everything with his hand. He's slower, but he can do it. And from the beginning, where it was like this and he couldn't do anything, he's now up to, I can move all my fingers. And this is very, very impressive. And you have to try it. You cannot tell everybody, yeah, we are having such a result with everyone. But if you try and the patient is compliant, you can have such a great success. For this guy, his next aim is to drive his motorcycle again. It's a little bit hard with his left side because he cannot, at the moment, he cannot give full pressure on it, but this is what he's working on now. And a few months ago, it was like this and never, no movement of his whole hand, of his elbow, of his shoulder. And now he's thinking about riding his bike. And I think this is what we can give them back, this opportunity. Okay. Now a sportsman, very different, back to backs. I would say it's an acute thoracic syndrome. Oh, sorry. It's too fast today. And it was one of my players when I was team doctor of Augsburg, first league in Germany. To the medical history, it was an acute pain during a training session on Wednesday. When he came back from a header, landed on the ground, it was a stinging, massive pain in the middle of the left thoracic spine. He was treated by the physiotherapist the whole afternoon, but without any improvement. In the evening, he called me at 10 p.m. So you see, it was really a big problem when a player is calling you at 10 p.m. And I told him to come to my office and I'll try something else, not only physiotherapy. And the myeloses were massive. He wasn't able to stand and breathe. And then I started with Shockwave on this cord-like hardening that he had in the left thoracic region, and all the trigger points around it were painful. So we worked on the trigger points. We worked on the muscles that were hardened. And after, as you see, 9,000 impulses by Shockwave with 2.0 and 2.5 bar, it was much better from the pain. The trigger points were no longer like dots. They released, and then it was able to do some chiropractic with him and was easily brought back into a normal position. And in a few seconds he said, oh, now I can breathe again. So sorry, missing word. Such a strong professional sportsman who has such myelinosis in this. This was really unbelievable. It was like hard as wood. You cannot do anything with your hands. It's in my opinion, no physiotherapist has a chance to get into there. But with the Shockwave device, you have the possibility to lose the hardening of the muscle, to be anti-inflammatory, which is very, very important for the result after 2 or 3 days. Because if this has the possibility to get more and more inflammation in this hard muscle, he will not come out in the next 2 weeks. And with this therapy, it was possible to get him back on the light training on the field next day, on Thursday. Then we did a Shockwave again. On Friday, he could do a full training without any issues. And on Saturday, he was in a match against Wolfsburg, one of our contenders at this time, because we're not so high in the league. It was very, very important to beat them. And now I show you the result from the next day. This is the guy, an Austrian national player, Michael Gregorich, very nice guy, and he scored 1 goal in this match and had 1 assist. He was the player of the match, and that after a week like this, I think this was very impressive. I have the same, not with a sportsman, but a very strong man that was a friend of mine. You can see a very big and heavy friend of mine. He had exactly the same, and the problem was in our city there's a what do you call that? Sorry, a festival every year, every 3 years, and he's a baker. He is the most important baker in this town, and he had to bake all the bread that you need for the whole festival. So that was one day before, and he had the sudden pain when he was setting down a sack of flour of 25 kilos. You know, a guy like this, 25 kilos, outstretched position of his hand, of his arm. There's a lot of strength happening there. And then he, after that, and the stinging pain that he had a Wishing analog scale between 8 and 9. And he had to work on because he was the only baker on this festival. So we did the same. He had, in this case, an emergency shockwave treatment of 7,000 impulses. And after that, it was really, really easy to get his thoracic spine back in a position that he lost when this happened. And the paravertebral region loosened the strength, and then it was possible for him to breathe again. And after 2 days, after 1 day, it was much better than 2 days later when the whole festival was ongoing. It was like this. As you can see, this position wouldn't be possible if he had stood like the 2 days before. This is a very important case for me because this is my wife. Sorry, this wasn't translated. This is a compressed radius head fracture that my wife had when she was pushed by her own horse. The horse got suddenly frightened because of a loud tone and pushed her at the right shoulder. So she fell on the left side, on her left arm, and had terrible pain and massive restriction of movement in this arm. And the MRI showed this, as you can see here, this compressed radius head fracture and a bad bone bruise and the hematros. Was 3 weeks before, and that was the day before my holiday 3 weeks started, so we could work on her every day. And just again a picture to see how the bone bruise is in here and here. And my wife is really, she normally she doesn't really suffer from anything. She's really hard. We have 4 children. You know, mothers who have 4 children are really hard mothers. But in this case, it was really painful. I will show you the whole diagnosis here. You can see. Here you can see the bone marrow edema on the other side. So it was a hard impact that she had. Here we see it again. Yeah. And that's the step between. And now what did we do? We did MBST means like a magnetic field therapy, but with high power. This is only for the bone, and high energy laser for the pain. But what we also did, and every day, was radial shockwave. For me, the most important one, because I think you can move this part, or you can have the best results if you do it, in this case, nearly every second or every third day. We had the possibility to do it every day, so we tried this. We also did, of course, cryolite for the cooling and so on. And she got such a lightweight plaster splint for day and night. Sorry, this should say day and night. And for 4 days. After 4 days, we also did the focused shockwave. That was not possible at the beginning because it was so painful. But with the radial for the first 4 days, the pain got better and better, and then we could do also the focused shockwave. She got a orthosis for the day, which only, let's do something like this from the movement, and nothing like this was very important because she couldn't do this movements at the first days, and the plaster splint was only for night. And of course, passive and active physio exercises, sorry, that I did with her. From the 28th of December, it means 10 days later, she didn't have any kind of plaster splint necessary. This should say X-ray. The X-ray control showed that there was no dislocation. Here you can see my wife with the plaster splint. Here the treatments. My son is doing the next dates. And here's the orthosis that she had. And now, after, in this case, on the left side, 14 days, we have this result.
So, also jetzt 14 Tage nach Radius, sind wir jetzt nach 14 Tagen und 10 Behandlungen mit
so 10 treatments in 14 days.
MBST und Cryolite Kältetherapie und einer bei diesem Ergebnis, was die Wirklichkeit angeht, also am Anfang war die Wirklichkeit hierbei. Einmal anziehen, bitte. Gut, strecken bitte. Ja, da fehlen uns jetzt noch 10 bis 15 Grad. Und dann
okay. What I'm saying here in German is that we started with 10 to 15 degrees movement at the beginning. That's like this and this. That was all that she could do. Very painful. And now you see what we have after 14 days. I mean, it's 2 weeks. The next video shows after 3 days later, after 17 days, what is possible.
Also wir sind jetzt mit dem Ellenbogen bei 7 und 10 Behandlungseinheiten oder 11 Behandlungseinheiten jetzt. Jetzt zeig doch mal bitte, was schon bewegungsmäßig geht. Sehr schön, strecken. Sehr gut. Und jetzt mal drehen, bitte. Und zurück. Sehr gut. Gut. Und dann noch ganz wichtig für die Damen.
And for the ladies, very important, she could touch her hair again.
Bis zu den Haaren. Super. Okay.
This video, and you heard our baby with 4 children. The baby was 1 year, nearly 1 year old when this happened, and she had to have him the whole day. And this was the time after 2 weeks when she could have him on the arm again. After 2 weeks after such a fracture, I think this is a good result. And now I show you in the video how we worked on the elbow we treated during movement, or other way around, we did movement during the treatment. That's very, very important because I think not so many guys treat with movement and shockwave. I think this is very, very important. You can also do this, and I hope I can show it afterwards on a model that I have with the frozen shoulder. Very, very impressive. So this is after 19 days. My wife is moving the arm, active and passive, and we are working with the highest pressure that is possible. In this case, 1.6 to 1.7 bar on a broken elbow. I think this is quite good. That doesn't work as I want. So, and to show you how fast the recovery comes, it's just the little things in life that you cannot do with such an elbow come back very quickly. This is a video to show the smaller movements.
Verletzung also nachgefragt. Und heute geht schon so viel. Also erst bewegen, bitte. Okay, ausstrecken. Sehr gut. Und genau, innen außen drehen. Super. Und Alltagssachen sind auch wieder möglich. Also zum Beispiel eine Flasche greifen, hochheben, trinken draus geht auch. Die Flasche aufdrehen.
This is very important. Something like this normally works after 6 to 8 weeks.
Die Zeit der Schweinereien ist also vorbei.
And in Europe, very important.
Vielen Dank.
Okay. And
so, jetzt sind wir.
Right. Then the last step was trying to drive a car, and that was one day before my 3-week holiday ended. We had to control if this is possible because she had to, the day after, she had to drive with all the children for school, for example. And this was exactly after 3 weeks.
Nach 23 Tagen nach Ellenbogenbruch geht das Autofahren.
It's the left arm.
Man sieht, also der linke Arm war es, man sieht es ja kaum noch. Nichts für die Versicherung, aber müssen ja damit kriegen. Wir mussten ja testen. Ab morgen ist der Urlaub.
Okay. I was just laughing because it said nobody should show this video to the insurance. I hope you don't do. And all this without operation. Then you have to go on with the treatment, of course. After 4.5 weeks, we did 2 treatments per week, only Shockwave and the cooling bandages. Then after 5.5 weeks, physio did some weight on top for training, and after 6.5 weeks we had full movement and full strength back, and the MRI after 7 weeks said in comparison to the older MRI, remarkable improvement is going on, and you will see the picture now. That was the beginning and that was the end. It is turned around here. I'm not quite sure why they sent me the photos in mirror position, but it's definitely the same arm and definitely the same bone. And if you don't believe this, I have the videos again. This is
17.12.2020 bei frischer.
And that was the MRI after 7 weeks.
Kontrollaufnahme, Versatz bis zum gleiche Einstellung nach 6 Wochen.
Na, come on.
Und dann die Aufnahme ist um 180 Grad verdreht. Hier das Radiusköpfchen komplett wiederhergestellt.
You see there's still a bone marrow edema. The joint is
3 bis 4 Wochen
recovered.
auflösen, denn da zieht das.
The same again.
Tag der Fraktur in T1-Gewichtung.
Here's the fracture.
Der Versatz hier ist 4 mm in der Gelenkfläche des Radius zu sehen. Und hier jetzt
And on the other side, the fracture is recovered. Okay. And this is at the end that the full stretching was also possible. As you can see, after three and a half weeks, at the end, at 7 weeks with the MRI, that was a remarkable result and was only, in my opinion, only possible with a good patient, good compliance, and of course, Shockwave combined with passive and active physiotherapy. I always end with my sportsmen did really good speeches. I don't know what I'm talking about, but I know that I'm right. Sometimes with the Shockwave, it's the same. You try things and you have to try things. As I told you in the first step with the theory, you have to try things because they work. I know that they work, but sometimes you really don't know why they work, but they work very good. And I want to end with Dirk Nowitzki, who said, if you give everything, you can't blame yourself. I think this is very important for all of you. If you try and if you think about it before, you will be very successful at the end. And now I hope there are a lot of questions. And after the questions, I can show, if you want, I can show you on Tobias, a medicine student that I have here today, how we can treat shoulders or elbows or whatever you want. Or for example, back pain, it doesn't matter. You can choose. So thanks for your attention.
Thank you, Peter, for sharing these great cases. It's amazing how we can see the consolidation on the X-ray. That's really amazing. Yeah.
Thanks.
We have only one question for the moment from Destry Washington asking, is it safe to apply ESWT on osteoporotic and also osteopenic patients? Are there any guidance generally used for each symptom or case?
Yeah. So the first question, it's absolutely safe, no problem. There are a lot of studies about osteoporosis, osteopenia, and also pseudarthrosis and so on. They say that you cannot, you need much more pressure to do any harm to the bone, even if it's an osteoporotic bone. You cannot do any harm to the people. No, it's the opposite. You help them because you activate the osteoblasts so good and so much that even the osteoporotic bone will get better and better. So not at all. The second question was if there are
if there is any guidance to yeah.
Difficult because every patient is different and you always have to orientate on your patient and on the pain the patient has. We always, to make it easier, we always work with 20 Hertz or the new device with 25 Hertz because we all don't have to give away our time. And it is much easier for the patient because if you work with 6 or 8 Hertz, it hurts you much more than if you work with 20. It's much easier for the patient. So we always work with the highest frequency that is possible. That's the first. We don't like to give you a guidance for the elbow. You need 3,000 impulses, or for the neck, you need 5,000 impulses. This is only to orientate a little bit, but you have to have your own patients, you have to have your own experiences with every patient, and then you will come to, everybody has his own guidances inside then. For me, for example, I always start the neck with about 2.0 to 2.3 bar at the most painful trigger points. If I see this is okay, I can go up. If I see, no, that's too much for this patient, I go down. You always have to orientate on the pain of your patient and on the hardening of the muscles, for example. And you have to talk a lot to the patient. And if you talk to him during the treatment, it will be you will be successful very fast because you can orientate on what he says and what you feel. You feel that the hardening goes away. You feel that the pain is getting better. The patient is relaxing. The breathing is getting slower and deeper. And then you can see, okay, now I'm on a good way. And about the muscle chains, for example, there we have to have a look, for example, at what is my best anatomy trains, for example, is a book that's very, very good for muscle change. You can see how they, what you can reach with one point at the beginning or the end and how they stick together. Something like this would be very, very good if you want to treat in this direction, or a little bit of Chinese medicine, especially the meridians, for example, something like that would be very good. Oh, two more questions. Very good.
Yes, two more questions. The first one is from Prasanna Niki. Is it fine to do EZWT on points with rotator cuff and biceps tendon, partial tendon? Is it contraindicated? We had that question.
Yeah, we had that question. Yeah, that's difficult. Normally, it's contraindicated if it is a rupture of more than 50%, because then the possibility that there's a complete rupture at the end is very high, not because of the shock wave, but because of if you have such like this, the rest can also go away and rupture. So it's contraindicated if it's more than 50%. If there's only a little 10% or 20% rupture on the side, you can very good work with Shockwave very good, and you get faster and better healing, of course. But as I said in the theory before, when you have somebody who doesn't want to be operated at all, and he has a rupture of more than 50% and asks you if you can try it, you have to tell him that this is normally contraindicated because a rupture can occur in every time. But you have to explain him that it's not depending on the shock wave, but the rupture, it can also occur if he drives his car or something. And if they say, okay, that's fine with me, I want to have the shockwave done, I think the result will be very good because the pain goes away, the healing, you cannot get the whole tendon back normally, but the healing is a little bit better, or is better, of course, better than if you don't do anything. And if you get from 50 to 60 or 70%, it's much better than staying with 50 and getting less and less. So you can do it, but you have to talk to the patient if the rupture is more than 50%.
And second question from Judith Sandhya. What about shockwave therapy for trigger finger? How many times? And what would be the frequency and pressure for the treatment?
Okay. Frequency, of course, always high, especially with trigger fingers because they are very painful. So you can try it on your own fingers. If you don't have trigger fingers, it doesn't matter. Go on your fingers with 6 hertz or 7 hertz and then go up to 20 and you will, okay, that's a big difference you will see. It's funny to see the faces of the guys doing this. And the pressure is, you have the possibility with the DuoClast to go down to, I think, 0.2, 0.3 bar. Sometimes at the trigger fingers, you need that because they are very, very painful when the inflammation is very big. If you do it in a way that is not so painful for the patient at the beginning, the patient will come up and say, oh, that's okay, go on. And then you will see after the treatment, you are with 0.8 bar, for example, at the beginning. There are guys, you can start with 1.2 or 1.3 bar, and at the end, you are at 1.6, 1.7 for the first treatments. That would be great, but sometimes there are really patients that are suffering so much that you have to go down nearly to 0.2, what the DuoClast can hardly do, and then go up and up. But with every treatment, you can go higher. And I think at the end, everybody has the possibility to stand about 1.2, 1.3 bar at the fingers.
Okay. Thank you. Thank you. I have a question myself. Do you always recommend your patients to do some, let's say, some exercising, some rehabilitation exercising after a shockwave treatment, or do you recommend some rest, or does it depend on the indication? Or?
Yeah, it depends. Normally, if it is something that is it's treated for the first or second time, it's possible that I tell them to have a rest because of we sometimes have the first that is getting worse after the first or second treatment. That's normal because it is really working in there, and the people say, oh, that was harder for the next 1 or 2 days. That's possible, and I tell them that, and that they should have a rest for about 1, 2, or 3 days. But then I try after the second, third, or fourth treatment to get them back into their movement very fast. And they should do anything they want and anything that is not painful. If they stay with this, that they do only things that are not painful, then it's no problem. If they try to do more and more than the pain tells them not to do, then the results will get worse and worse. But if they really let you treat and then do only what they feel that it feels good and not painful, then you can increase the load very, very fast, and they can do more. And stretching, of course, and something, but always the same. No pain is better than pain when they do their exercises.
Okay, so that means in the first treatments, you let the body and let's say the tissue do this kind of auto recovery
exactly
process with revascularization, reconsolidation process.
Yeah, that's
and
it.
Then
because the growth factors and the stem cells that we activate, they should have the possibility to work on the body as good as possible. And I think for the first 1, 2, maybe 3 treatments, it's good to give the body and the tissue the time and the possibility to work as good as possible. And that's only when you give a little rest, for example. It's sometimes different sports and professional sportsmen because time counts and time's money. There we can do it a little bit different, but normally with normal patients, it's like I said before.
Perfect. Thank you very much.
No problem.
No other question? Any? Feel free to ask any questions you like.
Or should we do any? So Tobias is here. Should we do any treatment?
Live? Yeah, sure. Let's go for it.
Then I turn around.
The patient is ready.
For example, what we can show very well, I think, is we always have the problem, or a lot of people have the problem with the neck, and then the neck, shoulder, arm problem. I think we can show how we do. I don't do the whole treatment because I tend to about 15 minutes, I think, for the whole, but I show some points and then I stop again and tell something. And if there are questions, please ask. We're now turning around, but I can show.
Oh, perfect. Thank you.
Very good. Say hello to Tobias.
Hi, Tobias. Peter, just to have a good vision of the room, would it be possible to switch off your presentation? Well, switch off.
Of course.
Get off your present, because we just see a little screen, and it would be great.
So is it better now?
I still see your presentation.
Okay. Stop that. Stop it.
Now? Perfect. Perfect.
Okay, perfect. Yeah. Okay. Ich glaube, es ist so ganz gut. So. Okay, everybody knows the device, I think.
Yes, everybody knows. So we have the radio shockwave therapy with the Swiss DuoClast and focused shockwave therapy with the Swiss DuoClast.
Yeah, very good. Now we do the radio one with the Evo Blue handpiece. Can you understand me?
Yes, sound is perfect.
I want to show you how we treat a shoulder first, and especially a special thing with the frozen shoulder, for example, because then we have what I said, movement and physiotherapy during the shockwave treatment. First of all, I always start at the biceps, for example. You can also start with the supraspinatus, but in my opinion, I always start with the biceps problem. The biceps tendinitis is normally treated in this area up to the capsule here, where you can reach the capsule very well. The AC joint here is also an area where you can treat very, very easily. Then you go back to the supraspinatus part or infraspinatus. Both are reached here and there and at the shoulder. And then we normally do also the deltoid muscle because it's also very painful with the frozen shoulder. And if we have done this, you normally after the treatment tell the patient to hold on his arm as high as he can. And a frozen shoulder normally is like this, for example. You cannot get higher because it's very, very painful. Then you can take the shoulder only like this and get a little bit up. If you reach the 90-degree point, it's normally that the patient takes his neck like this. Very good. That's not what we want. What we want is to have his shoulder high, but his neck low. So you can put his arm on your arm, hold your hand here on the neck so that he has to stay down. Put your device on the points where you want to work, and then get up as fast as possible or as good as possible. Normally during the treatment, you get about 10 to 15 degrees, which is a lot for one treatment. They cannot hold this result for 1 to 3 weeks, but if you do it every week and try to get up during the treatment, it's much easier for the physiotherapist during the week. And after 1 week, you will have the same result as you had at the end of the last treatment, and then go further. And we go here into the capsule, the AC joint, and then I try to get it higher. And you can also work on the bicep. And another thing is you can then let him be active. Means this is the passive part, and now you can tell the patient to do the rotation. And he can do this during you're doing the passive part to get the abduction in a better way, and the patient can do the rotation while you are working on him. So you have 3 treatments in a row. Okay. When we are talking about neck and arm, we always have to talk about the muscle chains, of course. Means that we have to talk about biceps and elbow. The tennis elbow is not, for most of the patients, not the main problem, but always when you have someone suffering from shoulder problems, and you go down to the extensor tendon here at its beginning, you will always have pain here. That's clear, because if you cannot move your shoulder properly, you try to do more from your forearm. And so it's too much load for the forearm, and then the problems begin here. Another point, here we are back to the Chinese medicine. Another point, a very for us, very important point in treatment is the pain point here between your thumb and your first finger. In German, it's called Dickdarm 4. I don't know what it's in English. Intestinal 4, I don't know.
Colon 4.
Colon 4, I don't know. But this point is very important.
Meridian 4 of big intestine, right?
Yeah, intestine 4, I don't know. Yeah.
Yeah.
This is a very, very important point. And the funny thing is, you can try this on your friend. For example, it doesn't have to be a patient at the beginning. Everybody has a little pain on the biceps today because we are always sitting like this. So it's always a biceps problem. So if you treat someone here and he says, ooh, 1.8, 2.0 bar, it's painful, then treat him here, then this is painful too, and then treat him on this point. If you come back to the first point, you can do 0.3 bar more without any problem, I'm sure, and I swear. We will try. Now it's painful. Okay. This is enough for him, he said. Now we will see what's here. Okay, he's feeling the pain. When we started here, it was 1.8 bar. It was painful. I did this point with 2.0 bar, this point with 2.2 bar now at the end. When this went better, I stood with 2.2 and put this here where it was painful at 1.8. Now 2.2 is okay in a few seconds. So if you work with muscle chains, if you work with some Chinese medicine points that are really, really interesting, you can have results that are really tremendous, really great. And that's what I want to show. It's the same, for example, if you work on the shoulder, you have to work on the neck. That's what I show again.
So you use the big applicator, right?
Sorry?
You use the big applicator, the flat one.
Always the big applicator, yeah.
Okay.
If you have, for example, a problem on the elbow and you see or you feel that it's getting better, but a small point is the most important point, then you change to a smaller one and then put it on there. At the beginning, when you always also do the muscles of the forearm, I didn't do it now because of the time, but if you work on the muscles of the forearm, try the big one. It's much better than the small one. The small one is more painful and you don't reach the whole muscle.
The muscle chain. Yeah.
But if you have the offspring of the tendon, then you go on the point exactly, and then you can use the smaller ones. Or even, for example, the focus. That's after the second or third treatment, if you know, oh, there's a point that is not going away, all the other things are getting better, but the point is not getting better, put your focus on it and give him.
Okay.
Yeah. But for all the other indications here, the focus at the beginning would be too small in reach because the focus is very small here. Okay.
Ja, habe ich heute Morgen für das und dann.
Okay. For the neck, it's very important for me to tell you all that you can work until I would say cervical spine number 7, vertebra 7. It's the one that you can feel best in the back when you're touching. You can stay up to this high with your pressure that you need in the thoracic spine. But if you go higher, lower it down. It's very important. 1.0 bar, 1.2, not more, because you don't need more, and it is loud, and maybe it is not so comfortable for the patient at the beginning. Okay.
Okay, Peter.
Yeah.
Just a quick question: would it be possible for Tovia to stand? Yeah, because we don't see. Yeah, perfect. Perfect.
That's what we meant with compliance.
You have a very compliant patient.
He has to, as a student. Okay, and what I normally do, I start with the trigger point here at the edge of the shoulder blade, and then I go with the trapezius muscle, and I go down at the shoulder blade and back to the paravertebral part of the thoracic spine. This is an area that should be work with the device really hard on it, because most of the problems come from there and from myoglossus in this area and from the paravertebral little joints in here, and you can reach them because you get about 4.5 to 5 centimeters deep. And I'm working with real pressure on it, not because you need the pressure for the treatment, but I need to feel how the muscles are. If you have much too hard muscles, you can feel the trigger points and the hardening of the muscle, where trigger points are much better if you have some pressure on it. If you only go like this on the surface, it's you cannot feel it back. You get no response, no feedback from your body. And I think it's especially for physiotherapists who are working with their hands all the time, it's very important to feel what you are doing. And the big applicator gives you a good feeling how the muscles feel and how hard they are and how they develop during the treatment. That's very important. That was in short a treatment that we normally do. He was telling me during the treatment that especially the points where it was very bad at the beginning, down here and here at his thoracic spine, went quickly better. And that's what I want to hear. Now, normally you can also do this when you're lying down, it's no problem. Working on the cervical spine is easier when they lay down. I'll show you how I normally get the position of the patient. You also can work on the patient like this. For some of them, it's easier like this because they can relax better than do it in this position. That's perfect. If you have the possibility to get the head part down and you want to reach the neck, turn around a little bit. It's better to get it a little bit down so that this is straightened, and then you can work here on the cervical spine. I'll just show you in short how this normally works. But I think this is important also to show you how high you can go, because here's the occiput, the end of all the paravertebral muscles, and that's where we want to go. Perfect. He had a little problem with this trigger point over here since this morning. And the trigger point came up to here when he was driving to my office. This was exactly where he had the baddest, the pain that he really feels is in here. When I come up here, he can feel the pain here and here. And that's what he told me. And when I stay on this point, it was the same with him. After 4 seconds, I counted inside. After 4 seconds, he said, okay, now it's gone. And that's what I want to tell you. It's really in nearly every case, if you find the points at the occiput bone here, 4 or 5 seconds, and they're gone. And then you can go back to the trigger points and tell them that they should tell you how the pain developed and get up with the pressure. And then we'll see, okay, this is like a feedback. The trigger point got better and this point got better. And that's why we always work here together. It's also the muscles going down here, like the trapezius or the sternocleidomastoid muscle. You can work on all of them from the beginning to the end. And if you get a relaxing or losing of the hardening during the treatment, it's quite sure that the next hours, the next 2 or 3 days, it will go away normally for the patient. Okay, good. So that was in short from the occiput level over the shoulder down to the intestines 4. I think this is important just to have heard about it, that this is possible. Any questions?
No questions for now. Just quickly for me. So when you are when you treat with your with the handpiece, you follow the line of insertion of rhomboids muscles.
Yeah,
right?
Exactly.
Okay.
You can reach all the muscles in there. You don't have to be afraid of the lung behind it. There's always the question: isn't it contraindicated because the lung is down there?
Exactly.
Yeah, right? The lung tissue is there, but you cannot get so deep with the radial one that you can do any harm to anybody. The only thing that is possible is that the patient gives you a little cuff. Maybe that this is a position where it is not so good, but it cannot do any harm. But if he's coughing, go away from this. from this area. We are also treating now patients with the long COVID syndrome, with problems with the breathing, or my chronic bronchitis patients. We are treating them for the last, I would say, 6 months. Now it's more 8 months. We started to treat them by Shockwave because one of the biggest problems is the muscle hardening, the intercostal muscle problem, the diaphragm problem, and we can also treat this by using the intercostal muscles and the whole back muscles, paravertebral, and the rhomboids and so on. If we get them loosening their tension, then I think we can do them a lot of good, because the breathing is getting better and better. And after the first treatment, they will say, "Oh, now breathing is easier." And so you see, you cannot really do any harm to the lung, but never use the focused. I didn't. It's not very logical to use the focused one because it's very small. The point where you can work with. And you don't want to work on small parts, but you want to work on the whole intercostal muscles, the whole rhomboids. So don't take the focused one. And the focused one goes deeper and on a smaller point. So maybe if there's any harm to do to the lung, then you do it with the focused one. But there's, I think, only one example in the whole world of shockwaves that something like that happened, and that was the company tried to fix a new device on the market, and they did it with a model with the highest level of the settings, and as I think that was the only one that was possible to do any harm to the lung tissue. Not bad, but that was the end of the company. That's the story that I heard, because nobody would go with the highest settings level, with the highest intensity of a focused into the lung tissue. That's absolutely nonsense. But if you do it radial, you're safe.
Okay, perfect. Thank you, Peter. Thank you.
And
another last question I have. I was thinking, because I have a few friends who are opera singers, and would you recommend to do some kind of shockwave therapy before a concert to relax the cervical muscles, or would it be too risky to?
No, not at all. That works really perfect.
Because I heard it could. I heard that it could have a kind of a better deployment of the voice, but I didn't try it. But
that's right. The funny thing is, Professor Schmitz has got, I think, a friend of him.
I think he had an example. I think this is why I just remember that.
Yeah. And she loves it, and she always, when she's at Munich with him, she always tells him to do this shockwave therapy on her neck, because it makes her freer and she can get higher with the tones than others. Wow. I think this would be a really good treatment for people singing in this high range. So this is, of course, very, very good. That's the same with the migraine headache patients that we work on, because it's in most of the cases it's a combined tension and migraine headache, and they are suffering really bad. But I would say about 80 to 90% we get better, much better in frequency and in the quality of the pain.
Wow, thank you very much. So I will tell my friends to have a shockwave treatment before they are performing. Thank you.
Okay.
Okay, any additional questions? Dear participants, any questions? No? I think, well, if you don't have any other question, I think we will close the session and see you next time online. So thank you, Peter. Yep. Thank you again for your great expertise, very accurate settings. Thank you. It's always a pleasure and always interesting to listen to you.
Thank you.
And what you practice. Thank you, Tobias, for being the model today. Thank you. And so thank you again, Peter. And thank you all for joining this session. We hope you enjoyed this practical session, and we'll see you next time online on the 11th of November.
Yeah,
And
then
it
we
will
do
be
lower limb.
Yeah, for next time it will
Now
be
it's
a
clear,
lower limb
lower limb.
session.
Okay.
Yeah. So same timing, 11 o'clock for European practitioners and 7 p.m. for South Korea. Thank you again all for participating, and we'll see you next time online. Thank you, Peter.
Thank you. Bye.
Thank you. Bye-bye. Bye-bye, everyone. Bye.